Welcome to Inside Aesthetics, the world's leading podcast for injectors and aesthetic businesses. I'm Dr. Jake Sloane, an aesthetic doctor with over 16 years experience in facial aesthetics.
And I'm David Segal, an entrepreneur and business mentor with over 20 years of experience in our industry. Our podcasts are aimed at industry professionals, and any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
You can also subscribe to us on Patreon for on-demand content for injectable and business education. We're going to start a new mini-series today, David.
Another one. Yes, let's do it.
Well, it's going to be, let's see how it goes and see how much we have to talk about. Okay. Because these ones are deliberately non-planned. I've just sort of found some articles and interesting things that have been happening in the aesthetic space. And I think it's, interesting to talk about these things and I guess they are of global relevance. Mm-hmm. So first of all, what's news in our Patreon? Do we have any new offers for people? What's happening in that space before we get into the new mini-series?
Well, we've set up a deal with a company or a collaboration with a company called Heidi Health, which is an AI piece of medical scribing software. So it helps you with all of your clinical notes. So rather than having to bash away at a keyboard after you've done your treatment and trying to rush between patients, this piece of software does it all for you in the background and takes away all of the slog work when it comes to your clinical notes. So you can actually do a free trial with them. So you go to HeidiHealth.com. So you can obviously go to our offers page and get a link directly from there. But you sign up for a 7-day free trial. And then if you decide that you want to do something more long-term and implement it into your practice as an AI listener, IA, yes. As an IA listener, you get a month free off your annual subscription. Cool. So we're living in a world now where we have got less time and more to do. So it seems like a sensible thing to consider, or at least give it a try. And
that's an interesting offer, yeah.
And it helps you with your accuracy as well. I think, because sometimes it's hard to remember everything, or you might, human error. It eradicates human error to a large extent.
Brilliant. And then I guess a reminder of an offer that we've sort of mentioned previously. It's with a company called Bacteriostatic Water Australia.
Yep.
It's been really popular. A lot of our listeners have taken up on the offer, and essentially they make preserved water or preserved saline made here in Australia, but they ship globally. Yep. And I am aware that in some countries it's difficult to get hold of these things, or things go out of production for whatever reason, or they're lacking resources. So it gives you more of a steady supply, but also it's obviously a reputable and safe supply. So they will ship across the world for an extra $30. Of course, around Australia, it's free, I believe, the shipping. And if you use the code IA10, you save 10% off the advertised prices. Yeah. So, that might sound insignificant, but preserved saline is, of course, slightly more expensive than normal saline. But I can tell you now, if you start using it, your patients will think you're a god. It's just so much less stingy with your procedures. And, when you actually factor it down to per unit, how much does it cost more per unit of Botox? It's almost nothing.
Yeah. Yeah. And trying to get an edge on the competition.
Yes.
And offer something that no one else is offering. It's an easy step to improve your patient experience.
Yeah, absolutely. And then I guess just a reminder of an offer that we advertised through our IA webinar a few weeks ago. It's with a company called LTF Digital. They're our digital marketing kind of experts that we've partnered with. And they're based in the UK, but they've also got presence here in Australia now, but they also service clinics all around the world. So they've worked very closely in the past with Allergan. They're now working with Mertz. They support big clinics, small clinics, plastic surgeons, and of course injectors. Mm-hmm. So again, if you make contact with LTF, just using the link in our podcast description, there's a link to either their UK or global sort of aspect, or their Australia, New Zealand aspect. And if you quote the code IA10 when you contact them, again, you'll save 10% off your whatever service you choose to go with.
Yeah. It's
It's a no-brainer.
It's a no-brainer, yeah. And I guess especially for those clinics in Australia now that are going to be needing to reconsider their marketing strategies or clean up their website and implement things like Google My Business and automation, now's a critical time to think about those things.
Yeah, and kind of you should have been thinking about it before, but now definitely should be.
Yeah, absolutely.
Absolutely. So what's this new mini-series all about? We haven't quite entitled it. Right now I'm going with the title of What's Trending in Aesthetics. I might change it by the time this comes out.
Working title.
Yeah. All of us on Instagram, or we read the paper and we come across stories. Some are shocking, some are just interesting. And so I don't know how frequently we'll do these episodes, but I think it's relevant to let people know what's happening in our space.
It's hard to stay on top of it all.
Absolutely.
Just bombarded with 24-hour news cycles. So, So what's the first one we want to talk about? It looks like CDC warning after 19 women become ill after using counterfeit Botox in 9 states.
Yeah, so this is the United States.
Jeez.
So this story was going around about a month ago. I came across it, and in fact, through the various WhatsApp groups I'm on, including our Patreon, there were people sharing this story from the States because they were worried. So, this isn't, I guess, a US specific problem. It was just highlighted recently. But we know that there are counterfeit products being, I guess, parallel imported to countries or illegally imported to countries. And, clearly that's a risk. But I just think that injectors, for whatever reason, I see it on WhatsApp groups. I've joined an American one recently just to kind of keep my eye to the ground and find out what's going on the other side of the world. And you've got injectors literally selling to each other on a WhatsApp group, like products, like fillers, tox, and other things, threads. And you're just thinking, this is crazy. Because, what is the source control? What's the temperature control? What are the controls and checks and boundaries? There aren't any. So I know that this is happening because I've seen it with my own eyes. But this story highlighted that, 19 women became ill. I believe 9 were hospitalized with botulism type symptoms. And that's serious. If you've got botulism, which I guess the most common source is through eating badly cooked food or poisoned food, I guess, of course, you've got biological warfare. That's a possibility of getting botulism. But the third one would be being injected with a fake product that's not safe. And maybe the dose or whatever is incorrect.
That's crazy, isn't it?
So, these women complained of all sorts of symptoms from, total system paralysis, which also means your diaphragm doesn't work, so you can't breathe, to funny symptoms, numbness, facial drooping, and all the rest of it. So pretty terrifying.
How quickly do those side effects kick in?
That's something I can't really say because I guess it depends on dose, I would assume, and how much you're exposed to and what the source. Was it ingested or injected? I have no idea, but you'd assume it's pretty quick. And, just a disclaimer, if you've ever suspected that you were injected with something not quite right and you got symptoms, you take yourself straight to emergency because it could evolve very quickly.
Yeah, right.
And obviously if you got it wrong, then at least you've been checked out. But anyway, it was kind of interesting because the CDC's sort of advice was ask your provider if they're trained and ask if they're using legitimate product. That was their solution.
Oh,
it was like, well, do you think that,
they're going to be honest with you.
If someone's willing to use a fake imported drug, they wouldn't also lie about that. So again, I don't want to talk about regulation yet again, but it does kind of fall under the remit of, well, if that's being tolerated and that's their advice, what do the states do? What should they be doing that we are trying to do here with regulation? And, we've got pretty strict border force controls here.
Well, they've got a pretty porous border in the United States at the moment.
Yeah.
Obviously the southern border is an issue. I know there's the sort of the Canadian-American border that's an issue as well. And there's a few other bits and a few others around the place that are an issue as well. So it's not just fake toxins that are coming in. You've obviously got a fentanyl crisis as well. So it seems like there's just a issue with dodgy things coming across the border, and one of them happens to be Botox. There's probably fillers as well we haven't heard about yet. You
Correct.
Can assume.
And by the way, we're using the word Botox because that's what was quoted in this article, but it could mean other brands. I have no idea.
Yeah, right.
I don't actually know if it was fake Botox branded toxin, but it's a toxin.
Yeah.
So that's pretty scary. And I guess as an injector, if you have unwittingly ever bought product through another source, you really want to be checking what's in your cupboard. And my strong suggestion, I don't quite know how it works in the States, whether you buy direct from, the company or reputable pharmacies, but please start doing that and don't buy on Facebook. I mean, it sounds so obvious, but it's rife.
Yeah. Have you seen a lot of people in the States warning about this on their social media? Because they probably we need to make patients aware too, right?
Yeah, it was doing the rounds a few weeks ago, and a few colleagues in fact, I shared the article on our Patreon because I was like, guys, because we've got an American and Canadian WhatsApp group. And so, I was just trying to get the word out. But conversely, it was sent back to me just in case, it was of relevance to us.
Yeah.
Because, these things could invariably happen in Australia or anywhere else.
Yeah.
So, there's just some really common, simple things that you can do. Obviously, having a record of your batch numbers, and that can be source checked. So if you really wanted to, you could contact the pharma company and say, is this legit product? If you're not sure.
Yeah.
They all come with, obviously, expiry dates. They have a special hologram on many of the brands. If the packaging, for whatever reason, doesn't look quite right, or, for example, a common thing in Europe might be if you've got parallel importing between different countries, often on the box, it might be in a different language. That's a big red flag that potentially you might have something dodgy. I'm not saying it always is, but you probably want to be buying stock that is for your country. Rather than trying to sort of, save a few dollars here and there to get it from Poland or wherever else you're buying it from. That's not possible in Australia as far as I know. I mean, we buy from our pharma companies or our distributors who are based here. It's pretty good here.
Yeah.
We did have that case where we spoke about on our podcast where we had a non-TGA product that was used and sort of spoken about at a conference.
Yeah.
And that was quickly sort of closed down once it became apparent that it wasn't licensed.
Yeah.
But it's pretty scary, that people are ending up in hospital.
Yeah. And then I wonder what the medico-legal fallout would be of that. So the practitioner injected a product that caused a major problem for a patient.
Oh, can you imagine? Yeah.
Well, I'm just trying to think through where would the legal system find itself in terms of who it would go after. Would it be I would assume it would be the injector because they've actually injected the product and they should have known better or they should have checked. I mean, America's the most litigious country in the world.
Yeah. And the lawyers, as we know, will go after everyone. Wherever the money is, they'll go for that. But I mean, a logical, I kind of think, ethical sort of route would be, well, why did the injector buy that product? What was the reasoning?
Yeah.
Because why were you on Facebook when you could have got it through, whichever company?
Yeah, I would say the injector would be in a lot of trouble, and I would say that their insurance company would not want to cover them for that. I'm sure there'd be stipulations in the policy that would protect the insurer from having to pay out claims for product that wasn't approved or legitimate. I'm assuming there'd be some wording in there that would protect them. So you could be in for a lot of financial pain.
Yeah. I mean, just what I found interesting, I didn't know much about the treatment of botulism poisoning, but obviously there is an antibody against botulism, and apparently that sort of, I guess, antivenom or antitoxin that they use in hospital, it works against all of the 7 subtypes of botulinum toxin. So we've got A to B, C, D, E, F, G, it must be.
Yeah.
And it works against all of them. So, if you were ever infected with whatever source, whether it's through food or an injection, it should save your life. But it's quite rare. Only 100 to 200 cases have been reported in the last 20 years in America, and that's through food and everything else. Mm-hmm. But 19 in a few months. Clearly, there's a massive spike.
That's nuts.
It's interesting. There's a complications group on Facebook where a lot of patients go to, and to be honest, there's a lot of I guess interesting stories. A lot of it, I'm not entirely sure what I believe and on what the patients report, but I think one of the patients who was involved in this botulism issue, she was actually in intensive care, and this did the rounds on Instagram as well. I saw it. She looked very sick, and still not quite sure of what actually she was injected with or where on her face or what happened, but it was a toxin. And she actually popped up, this patient, once she'd recovered, she made an appearance on this Facebook group and was very open about her story. So I was going to see if we could get her on the podcast, see if she'd be willing to talk about it in one of our disasters and solutions type episodes, but as a patient.
Yeah, that'd be awesome if we could.
If you're listening, I would love to have you on, but I will try and make contact directly because I saw her in that group.
Gosh, that'd be an interesting discussion.
Yeah, for sure, and very terrifying, I'm sure. So key takeaways. I mean, if you're a clinic owner,
oh my God,
and let's just say, I don't know, your team was checking the fridge and you found something that looked unusual. What would you do as a non-doctor but clinic owner? What would you do?
Well, first thing I'll do is take it out of circulation. Take it out of circulation, and I'd probably contact the company that supplies the legitimate version of whatever product that was claiming to be and get it checked.
Yeah.
If I saw anything like that, it'd come out of the cupboard immediately.
Yeah.
I'd try and find out if any patients have already been injected with it.
Yes.
I'd notify my insurer immediately, and I'd probably call my lawyer.
John.
In that order, yeah.
On speed dial.
Yeah.
Yeah, I mean, I totally agree. There's not much else you can add to that. But yeah, get it out of circulation and source track where it's been used already.
Yeah, absolutely. Have a list of patients that potentially have been treated with it. Yeah, let your insurer know exactly. Because the big thing with insurers is you need to notify them as soon as you become aware of an issue. They need to be made aware, because if you don't, then things like this can escalate really quickly. Like, you might make contact with the patient, you might say something that you shouldn't have said, you might make an admission you shouldn't have said, you need to just contact the experts immediately, your lawyer, maybe your lawyer first, then your insurer, to be honest with you.
Yeah.
And make sure it's a lawyer that understands medico-legal, because it's its own little world of nuance, and you definitely want to talk to someone that understands the space. And the medical side of things too.
One of our previous guests, Nicola Lowry, we were talking on WhatsApp just about general stuff, and she's interested in polynucleotides, which I don't think have made it to America yet. And she said, I'm sure one of the brands that you guys mentioned a lot has been launched here, because I've seen a clinic advertise and use it. So we did a bit of a search on the FDA. It's definitely not approved yet in America. So again, you've got clinics importing other products like, polynucleotides. And that's not to say that it's fake or dangerous, but it's not approved. Yeah. And so again, you have situations where maybe, other countries, they want a product like, I don't know, Profilo that's not launched in the States yet, or Reduran that's not in the States yet. And injectors are sadly tempted to sort of smuggle it across or bring it across. Yeah. So not please don't stack up your suitcase when you go to Monaco. Just wait for it to be approved. Yeah. It's not just about the safety. I mean, that's the most important thing. It's about the training. How do you best use that product? How do you know what you're doing with it? Yeah.
And what happens if you do have an adverse event, and how are you going to get support from the company?
Correct.
Can you get a clinical trainer out to help you?
Yeah.
It's just not worth it.
So that was one of the stories that I came across. Next one, this was interesting. Do fillers cause cancer? Have you heard of that one?
I've heard of that one, but I don't understand the rationale. I mean, the only thing I can think of is that the filler causes inflammation, and inflammation has been linked to cancer. So is that the hypothesis?
No. So there's a plastic surgeon in New York. His name is Dr. Spiro Theodorou, and he's the founder and surgical director of a clinic called Body Sculpt. So I actually reached out to him on LinkedIn, and he accepted my friend request last night. So I haven't had a chance to invite him on, but I will invite him on and see if he wants to talk about it in depth. But essentially, and I don't know if this story has been slightly reported differently to how he actually pitched it. So that's something I'll sort of a disclaimer that I don't want to say this story wrong, but he presented the preliminary study results of a study that he did, where I think about 50 patients were assessed after filler using a special camera called a SPY camera. Now, I don't know how it works exactly, but it looks into your tissues and it's able to see if your lymphatics are compromised in any way. And we know already that, filler in rare circumstances can cause swelling, malar edema, etc., because of potential blocked lymphatic outflow. So I don't think that's news. But the implication from what he was saying, and this is where I'm not sure where the science ends and the speculation begins, is, well, if you've got blocked lymphatics, and what the lymphatics naturally do is take away, toxins and fluid from one part of the body, they filter them through the immune system and gets recirculated. If that's compromised, what happens over time? That was his, I guess, the gist of the story. But it was reported as very sensational, like, fillers cause cancer. And I'm not actually sure if he was saying that. It was more of a, could this happen in 20 years' time, for example?
Wasn't quoted at all in the article?
I'll read his quote, actually. I may become the world's most hated plastic surgeon, but I had to raise my dermal filler fears. Dr. Theodorou said the problem is that with the substance itself, no matter how skilled the injector, the substance can still block these lymphatic channels. He immediately stopped providing fillers at his own practice following the research findings. Filler has also been found to trigger an immune response where the body sends killer T cells to attack what it recognizes as a foreign object, causing swelling. So a bit like what you said.
Yeah.
Cancer has been detected in a small number of patients where T cells attacked some breast implants, for example, he said. So he's quoted as saying that. Now, I understand the loose connection and sort of not the pseudoscience, but I understand the logic, but I certainly don't see any evidence.
Yeah.
And so, interestingly, I kind of as a response to this article, I saw Patrick Treacy sort of give a reply, and he said, well, yes, we know that fillers cause swelling, but in 20, 30 years of practice, we've never seen any sort of strong evidence that this is true, which I agree with wholeheartedly. But, that was a pretty sensational headline. And I think a lot of maybe not even inexperienced injectors, but just injectors would kind of said, well, what the hell? Pretty scary.
How long did it take us after the commencement of doing dermal fillers did we discover VOs?
That's a good question. So if filler was launched in 96 with Restylane, we had Per Winloff on talking about that. I think if you speak to people like Patrick Treacy and those sort of early pioneers, they just didn't see it, or at least recognize it, or have any disasters till the early 2000s, where and that's obviously because other materials started to be used as well,
right,
like silicons and polyalkamids and other things, as well as HA. And of course, people probably got more adventurous with how much they're injecting, where they're injecting, how deep they were going, and doing more parts of the face. So it may have just been the case that for years we were just lucky. And that there wasn't that much injecting going on compared to obviously now. But yeah, certainly by the early noughties, the 2005 period, there start to be reports of problems, and that's when hyaluronidase was sort of introduced, and Patrick was part of that.
Because wasn't aware of VOs when I was involved in the early days, which was around 2006, 2007. I wasn't it wasn't something that came in on my radar about VOs. So how many years would that be? That's like at least 10 probably?
A good 10. And that's not to say that there weren't VOs. It's just
they weren't
sort of reported or recognized. They'd probably thought, it's a bruise, you'll be all right.
And also, so that's 10 years before we kind of knew that they could cause that. Now we know. And so a VO is something that's pretty acute when it's serious. So exactly... It's going to emerge in manifests,
days or hours.
And you know exactly what's caused it. Whereas cancer can be like, there are lots of contributing factors. We don't even really know exactly what causes cancer. So, I mean, it's going to be a lot more difficult to prove or disprove, probably. So I guess I'm getting at is because Dr. Treacy said that he's seen no evidence of it yet. In 20 years. Well, I mean, that's not a conclusive response to say it can't happen.
No. I mean, I agree. I don't think he was saying I have the evidence. He was just sort of saying anecdotally through the literally millions of treatments done around the world in all countries of all backgrounds and ages, etc. We're not seeing like this unusual phenomenon of facial cancer suddenly popping up, which I think anyone can agree with. It's just fact.
Yeah, and it's also kind of interesting to think about the fact that cancer's probably something that manifests from lots of different things happening over time. So my understanding of cancer is that it's essentially your cells just reproducing rogue cells that your immune system can't mop up and get rid of. And sometimes people can be born with it, like with a genetic predisposition, or there are environmental and lifestyle factors or dietary factors that can influence how likely you are to get it. So is it the fact that we have bodies now that are just subjected to more assault from diet, lifestyle, and this is just another thing that we're doing that potentially could be the straw that broke the camel's back?
I mean, who knows? But I guess the way this was written, and I guess the data that I've read was presented, it was saying there is a local blockage issue here in the face or seemingly the under eye they were sort of focusing on. And so you would likely get a issue there rather than not like a colon cancer or something.
So it's kind of like it's not like a, it's very localized to where
I'm just speculating. That's how I read the article anyway.
Right.
So interesting. I'd love to get Dr. Theodora on to sort of go into that study, because I haven't actually seen the whole paper. I just saw like a real sort of snippet, really.
Yeah.
And the other side of this is that this was presented at a plastic surgeon kind of conference in the UK. We know that, again, sort of looking through Instagram, and we've had Dr. Talley on before.
Yeah.
He's been pretty vocal as a facial plastic surgeon about using certain biostimulators like Sculptra and other things that cause fibrosis in the face that, that causes issues, not from a cancer perspective, but it just makes things difficult for plastic surgeons. So I did wonder whether there was sort of an anti-injectable component to be sort of delivered to the plastic surgeons at their conference. I just wondered if there was a sort of an angle to that.
An ulterior motive?
Well, because Dr. Theodoro didn't say fillers cause cancer. He said, there may be an issue here. We need to look at it more.
Yeah.
And he's now obviously dropped doing fillers in his own clinic, but he's a plastic surgeon. So there is he has a solution. Mm-hmm. And so I don't know if there's any angle to what, why did he do the study, I guess is my question.
Yeah.
And was it funded? Are there any other disclosures that need to be made? I don't know.
Yeah. Yeah. I mean, I remember a couple of times I've been sick that I've had my fillers just exploded in my face. And it's just it's only happened twice, but it was pretty profound.
Yeah. So the concept of delayed onset swelling or nodules, sometimes people call it, that's a well-recognized, well-documented issue. I know, friends and people around the world who've sort of anecdotally told me this happened, that happened. It's often when you're sick.
Yeah.
It's often when you run down. It's often when you've had a vaccine, when your immune system's stirred up. And 99 times out of 100, it's self-limiting. You get better, it gets better.
Yeah.
And we've had Tom DeCutts on the podcast talking about this. It's almost like confirmation that your immune system's working. You've got a foreign implant in your face. You're sick, so your immune system is ramped up, and it recognizes this foreign material, and it says, hey, what's this? And you get some swelling and tenderness, which is a normal reaction to a foreign object.
Yeah.
So it's actually kind of unusual that doesn't happen to more people. It's quite rare. If you look at the data, it's sort of reported anything from 0.004% to about, if you believe one paper, 4%. But it's a minority.
Yeah.
So sure, but that's nothing to do with cancer. That's just some sort of delayed swelling.
Yeah. I did look like the Elephant Man.
Oh, well, you do most days. So it's all good. No, we're joking. You're lovely. Next kind of story, I don't know too much about this, but it's certainly noteworthy. There was a clinic, or they call it a Medispa, in New Mexico, so States, America again, and they were found to have infected 3 patients with HIV after doing what we anecdotally or colloquially call vampire facial. So PRP with needling on the face and then dribbling PRP on the face to sort of let it absorb. I mean, I don't know how that happened. Was it sharing needles? Was it cross-contamination through gloves? I don't know, but that's terrifying. What are your thoughts on that one? You run a clinic?
Yeah, I mean, well, there's only a few ways it can happen, right? Unless someone's rubbing their face on another person's face, because my understanding is that the HIV virus would die in oxygen within a few minutes. It's not something that can live outside of...
Yeah, it'd be a fluid. As we know, it's transmitted either sexually or through fluid or blood.
So it'd have to be, unless people are in the clinic having sex with...
then it's a possibility, but I think the inference was it was the PRP technique.
So basically someone sharing a needle, either intentionally or unintentionally, I guess... And then if it's unintentionally, what are your sterility protocols?
I mean, again, it should just be a never event, right? I mean, you do any procedure, whether you're catheterizing an old man in hospital or doing PRP in a clinic, you just follow procedures. You change your gloves, you have a dirty area, a sterile area, you do the procedure, you wipe down after, patient goes, you do your notes, and you're set up for the next patient. But you've seen crazy rooms in your clinic, for sure. It's not too much of a stretch of imagination to see how it could happen. I'm not saying it should happen, but...
Well, yeah. I think there's definitely an element of complacency in aesthetic clinics. I think that people sometimes just don't always appreciate the fact that things can go wrong, and you get busy. These are low-risk procedures. These are healthy patients, and things just slip through the cracks. I mean, you'd like to think this wasn't as a result of being a tight ass and reusing consumables, right? We hopefully assume this is just
I'm hoping
an accident. An accident, right? So I think it's just coming down to treating every patient like they do have HIV. Like, that's the protocols that you should probably be using. Just assume that everyone has it. So you're doing every possible safety step that you can.
Yeah.
But just it seems like it would just be complacency. Someone's just gotten lazy.
I mean, I've thought of a plausible kind of alternative, which actually should never happen again, but at least it's an accident rather than deliberate. Maybe they've been spinning blood from numerous patients and for whatever reason storing them rather than using them and binning them. And maybe they've just got blood mixed up from patients, because there are, again, not to mention any brands, there are some brands where you do some sort of storage and then you bring them back and you use that plasma. That's a possibility rather than sharing needles, which is fucking dumb.
So you think the vials have gotten mixed up, not labeled correctly?
I don't know. I'm just speculating, no idea, but it could happen, and it would be hopefully more plausible than just sharing a needle.
How many patients were there? 3?
3.
Over what time period?
I'm not sure. I think over a couple of years, but they identified it to one clinic. When they did the sort of, well, I guess when the patient presents sick and they eventually go through the doctor and they eventually get diagnosed with HIV, obviously the question is, well, where did it come from? Is your partner sick? Are there problems in your marriage? Who's sleeping around? And once you've kind of done that source control and you realize none of that is valid, well, where else were you exposed to fluids? And they said, well, I had this blood thing in this clinic, and it happened to 3 people.
Imagine if there's people who don't know that they've got. Is there more victims that don't know, that haven't presented?
Well, that would be my worry, wouldn't it?
Well, yeah, because they might not have presented with AIDS yet. They might just be HIV positive, but they haven't got the actual symptoms of the virus yet.
Yeah.
That's scary. We had a similar situation in Sydney about, feels like maybe 10, 20 years ago. There was a doctor in Sydney that was doing IV, like vitamin infusions, and he gave a few patients Hep C.
Oh, wow.
Yeah.
So, I mean, again, was he sharing? I
think he was reusing stuff.
Holy shit.
Yeah.
That's terrifying.
So
what happened to him?
I think he got suspended for a while. He should have probably been struck off.
I was going to say.
Yeah, he got suspended for a while. I'll actually see if I can bring it up now. It's probably still in on the public record somewhere in the news.
So that was in Sydney. Yeah. I think it was before my time.
It was I'm pretty sure it was in Double Bay in Sydney, not far from here.
Right. Well, whilst you're looking for that, so again, I think your advice would be the same. If you're the clinic owner and suddenly you realize that something's not quite right with your sterility in your clinic, you're going to be doing the same things. You're going to be contacting your insurer. You're going to be stopping that service immediately. Anything else that you would add? I mean, would you take that injector out of the workforce?
Probably. Probably, yeah.
But as in, like, legally, where do you stand as an owner to say you're not working now?
Well, that's a summary dismissal.
Right.
I mean, that's a serious patient safety issue. If you've got like issues where someone's stolen from the clinic or put patients in harm's way, that would quite often, depending on your employment contract, but that would be what I would have in my contracts, as it would constitute a summary dismissal. So they're basically
means
gone.
Goodbye immediately.
Oh yeah, absolutely. I mean, that's like, it doesn't get more serious than that, does it? Really?
What if that injector, for argument's sake, says, no, that's not true, didn't do that?
Well, I guess you'd have to prove it, wouldn't you? I mean, the onus would be on, like, what's it? Innocent till proven guilty. You'd have to have evidence to prove that they'd done the wrong thing or haven't followed protocol.
Yeah.
but serious stuff. I mean, this is why systems and processes are so important. And I was alluding to this in the previous chat we had earlier in the day. When you've got busy clinics with multiple staff and different types of treatments that you're doing, you can't, when it's just you, it's fine because you know what you're doing. But once you start having multiple people involved and you've got patients everywhere, you need to have processes.
Yeah.
Otherwise, things like this slip through the cracks. I mean, you still see it in the public hospital setting. I mean, I was hearing a story a few years ago about someone got the wrong leg amputated. Like these sorts of things happen.
Yeah.
You know, it's like the Swiss cheese.
cheese.
Yeah, just everything lines up and, you know, bad stuff happens. I found this article.
Oh.
So his name was Dr. Daniel Hemiri. Mm-hmm. This was back in November 2011. So this is from the HCCC website. So, yeah, Healthcare Complaints Commission recently prosecuted Dr. Daniel Hemiri, a general practitioner, before the Medical Tribunal of New South Wales as part of his general practice. Blah, blah, blah. So this was intravenous vitamin C, intramuscular vitamin B, and intramuscular magnesium.
Right.
The prosecution related to Dr. Hemiri's poor infection control standards, which resulted in 3 patients acquiring acute hepatitis C after receiving therapy at Dr. Hemiri's practice. Dr. Hemiri admitted that the 3 patients acquired hepatitis C via the spread of infection blood during intravenous procedures performed at his medical practice. He also admitted that as of 23rd of March 2007, his infection control standards are not as effective in a number of areas. That's interesting. In its decision, 11th of November 2011, the tribunal found Dr. Hemiri guilty of unsatisfactory professional conduct and, in one case, professional misconduct. The tribunal reprimanded Dr. Hemiri in the strongest terms and ordered he pay a fine of $25,000, which seems a bit light.
Yeah.
The tribunal also imposed a condition on Dr. Hemiri's registration that he be subject to an audit of his medical
That
records.
seems pretty light to me.
That doesn't sound like...
Slap on the wrist.
That doesn't sound like in the strongest terms. That doesn't... $25,000, and let's look at what your processes are. That's for giving 3 patients a lifelong medical condition.
Yeah, that's insane. I wonder what the insurer had to say about that.
I don't know. Crazy.
And what happened outside of the HCCC, whether the patients came with their lawyers and said, well, that's not good enough.
Yeah, it's crazy. This was in the Sydney Morning Herald as well. So there's a lot of articles around it.
I mean, it does bring up an interesting point that I guess injectors may or may not have thought about. But, you know, you probably field questions from people saying, what services can I add to my clinic?
Yeah.
And IVs seems to come up a lot. I personally don't really understand why. It doesn't really seem aligned with kind of injecting. I understand it's a wellness sort of treatment and it sort of fits with looking good, feeling good. But, you know, there aren't many people who can say I'm an expert at IVs.
Yeah.
And so the training could be quite variable, let's put it that way. And, you know, if you're doing a procedure that involves normally putting a cannula in and mixing up some drugs and hanging up a bag and maybe adding vitamins to that IV bag, you can see there's many potentials for sterility issues if you don't know what you're doing. And if you're not doing that regularly.
Yeah. I mean, I know of nurses that have had issues doing PRP. They're not advanced in cannulation. Like they struggle to actually find
vein.
Find a vein and, you know, their patients get the shits, they get bruised up. It's something like if you're not doing it all the time, it can be difficult to become efficient at it. And then if you're not efficient, you become flustered. Maybe you make a mistake. The patient gets irritated. So... Yeah.
I remember how many times as a junior doctor I was called, that's your job basically, to take blood and put cannulas in people. You're like the little bitch. And it's hard. Yeah. And even mixing up the IVs and adding, say, antibiotics to an IV, that wasn't left to me. The nurses would do that because they do that every day.
Yeah.
I don't have a clue.
Yeah.
Because, as a doctor, I might prescribe, but I don't dispense.
Yeah.
So, you know, if you're dispensing IVs and setting up mixes of various drugs that you have not really much of an idea of what you're doing, which it seems many clinics do. They're offering, you know, Myers cocktails and this and that and magnesium, which can potentially cause cardiotoxicity and cardiac arrest if you get the dose wrong. Mm-hmm. Maybe think about what you're doing.
Yeah, well, it's that goes back to that question. You know, are you specialized? Are you trying to be everything to everybody? How broad do you sort of expand your treatment offering?
Yeah.
If you are going to expand it, do you need to bring in people that are already super experienced rather than trying to figure it out? Because, as you said, it sounds like there's a lot of potential steps along the way where you could have some sort of cross-contamination issue, and these are just the ones we're hearing about.
Yeah. I won't say the name of the clinic or whatever, but years ago, I was contacted by an IV clinic. What had happened is they'd made up, it must have had B12 in it because it was like red or brownie color. And the cannula was obviously put in the patient. They set up the drip, and the patient was like, my arm's a bit heavy and it's a bit painful, and then noticed the drip wasn't running properly. Essentially what had happened is the cannula had come out the vein, and the fluid was just going into the arm, like the tissues rather than the vein. So it's called an extravasation injury, where I had to manage some of these in plastics where, you know, let's say, for example, someone's on chemotherapy with a cannula coming through a drip and it moved. That causes a burn injury effectively in the tissues. So you've got vitamin B12 and other, I guess, irritant vitamins going into the arm.
Yeah.
And so you've got staining of the tissues, but also pain and swelling, and they couldn't use their arm properly because it was so swollen. So, you know, I said, you need to go to ED, you need to contact plastics, because what they'll do, or what I would suggest they do, is they basically make little holes in the skin with a scalpel, put another cannula in one of the holes, and they just flush it out with saline.
Oh my God.
Basically just wash the tissues out with as much saline as you can to get it out. Otherwise it's going to cause like a caustic burn type injury.
Jeez.
And that has implications for obviously what it looks like, but also the function of the forearm muscles and tendons. So these things are not to be taken lightly, as I guess the takeaway point.
If you think about it, it sounds pretty benign, doesn't it? I'm just getting a little IV drip, just a little vitamin infusion. It sounds safe enough.
I've worked at other clinics where, you know, they're using NAD to sort of use IV. And I think you've had one, actually.
Yeah, I have, yeah.
You reported yourself that you felt a bit racy in the heart.
No, I did.
A bit, you probably got flushed, and you know, that's kind of what it does. But imagine doing that on someone who can't take it, and they've already got a cardiovascular disease, and you trigger a heart attack. I mean, you don't know these things because you don't take that sort of history, and you just think it's a simple drip.
Yeah.
Or you put someone into pulmonary edema and they can't breathe because they're breathless because you've waterlogged their system. That's a common one. We see that in hospital sometimes.
Oh, my God.
You know, because you're giving old people fluids because they can't eat or drink because they've had an operation, but they've also got emphysema or whatever.
Oh, God.
Yeah. So think about what you're doing, guys, please. It's pretty scary.
Careful.
That was like the three sort of headliner things. And then we also came across an article. Well, you came across it.
Yeah, there was a girl in Sydney. So one of our locals called herself the Glut Master. And apparently she was someone that was, and this is alleged, I think she's denied the allegation, but she was posing as a nurse doing Brazilian butt lifts into people.
And the implication was, or alleged implication was, she wasn't a nurse or not a professional.
Yeah, correct. So masquerading as a nurse, which something that doesn't seem that uncommon. I was pulled up another article before this about another girl, not relating to aesthetics, but she was masquerading. For the third time, she'd been caught masquerading as a nurse.
This was a year ago or so?
It was a little while ago.
It was someone giving people vaccines. I remember the story.
Yeah.
So not related to aesthetics, but nevertheless, she was caught pretending to be a nurse, and it wasn't the first time she was caught.
No, exactly. So
I mean, that's weird, isn't it?
Yeah. It's just,
I mean,
here we go. Her name was Alison Mybus, pleads guilty, no medical qualifications. So this woman impersonated a nurse and dosed a colleague and his parents with vaccines, but she says she doesn't remember her offending.
Right. Okay.
Yeah.
I don't remember putting vaccines in people.
Yeah.
I mean, let's just sort of go into the nitty gritty. So it's often said by injectors in Australia that the problem is that if people are non-medics and happen to be injecting, they don't fall under APRA because, of course, they're not medical professionals. So they don't have a regulator, and therefore they get off lightly. But these articles seem to suggest that, well, no, if you masquerade as a professional and you tell people you are and you're not and you're caught, that's a serious offence.
Well, it's fraud, I think. And then I think there would be criminal charges potentially. I don't think it has to go through the medical system.
No.
You've essentially tricked someone into thinking you're something that you're not, and then giving them a treatment that's potentially been dangerous. Or, I mean, I don't know. I'd say there'd be implications outside of just the jurisdiction of the HCCC.
Yeah. So do we know how this girl was caught or how it came up? Did she injure people?
I think the article's locked. I'm just trying to see if I can find any more. So
That was the other one.
Yeah, the flu vaccine. So what was the other one? The
Glut Master.
The Glut Master.
I mean,
I'll find out more.
Look, again, this is all speculation, so, please don't sue me. But
Alleged.
Well, the assumption would be that maybe her source of supply was not legit because it's not going to be coming from a reputable supplier because they wouldn't sell to a non-medic or a non-nurse, at least here in Australia. And then, what is the quality control? Going back to sterility, what the hell's happening in the clinic? Where's she doing it? And of course, were there any injuries? I'd just be curious to know how it was sort of flagged.
Why don't we just hold this here for a sec? And I'm going to see if I can get someone to get me the article. Just hold on a sec. Okay, so I've actually got the full article here on the Glut Master. So this was on the 8th of May. This came out in the Sydney Morning Herald. So the Healthcare Complaints Commission, HCCC, issued a prohibition order in January against, I can't pronounce her name. Do you want to pronounce it for me?
Khadija Dandichil.
Okay.
Dandichi.
Yeah, barring her from providing any voluntary or paid health services in New South Wales for 8 weeks. That order expired in March, but the Commission released another statement on Wednesday alleging Ms. Dandichi had introduced herself as a nurse to patients before performing several procedures in which an unknown substance has been injected into the buttocks of patients.
Wow.
Spokesperson for the HCCC said the decision to issue a public warning followed a thorough investigation into complaints. Dandichi provided cosmetic injection procedures to more than one patient at Little Europe Beauty in Liverpool. That must be the name of her clinic, a cosmetic clinic owned by her and her brother. We've taken this step because Ms. Dandichi is not a registered practitioner and is not able to administer cosmetic injections in Australia, which poses a significant risk to public health and safety, the spokesperson said. The safety of the public is our primary concern and will continue to closely monitor the situation. Dandichi was given the opportunity to respond and make submissions before the public warning was released, but chose not to do so, the spokesperson said. The Herald sent Dandichi detailed questions about the allegations, the previous prohibition order, and social media posts tagging Dandichi's account, which thanked her for pumping my BBL up. A BBL, or Brazilian butt lift, is a colloquial term for glute enhancement, which is usually performed surgically by harvesting fat from another part of the body and injecting it into the buttocks. Dandichi did not respond to the questions, citing legal advice, but told the Herald she had never pretended to be a nurse and was scared of needles. Okay. The Commission alleges Dandichi injected the unknown substances at her brother's cosmetic clinic called Little Europe Beauty in Liverpool. The clinic has never been licensed to perform skin-penetrating treatments, the Commission said.
Okay.
Yeah.
We got the gist of the story.
Not good.
No. Whether you claimed to be a nurse or you didn't, you're still... I don't think she seems to be denying the allegation of injecting people.
Yeah, weird, huh?
But
scary.
It'd be worse still if you were masquerading as a nurse when you're not.
Yeah.
And the other thing that would be easy to trace is there's no script, presumably, for that substance, which we have to do at least here in Australia.
But you're assuming that she's using a scheduled medication.
Correct, that is true. Not that it excuses whatever you did to these patients. If you're not a nurse, you're not a nurse. But BBL's dangerous. You can kill people with that. You get it into the gluteal veins if you're too deep because you don't know what the hell you're doing. That's game over. That's a pulmonary embolism, and that's how these cases of deaths in South America have happened, and America.
Crazy.
Yeah.
So you just got like a clot that goes to the heart, and then
you've got a massive vein in your glute. You put some stuff in there, goes straight up your inferior vena cava back to your heart and into your lung to get reoxygenated, and it blocks it, and you die.
Jeez. Be pretty instant death, I would think, too.
Very quick and not very nice. So, yeah, I mean, that, again, the lack of insight just to make some money is terrifying.
It's crazy. You'd think that these people don't really understand the implications. Any reasonable person with a conscience would probably not make the decision to do those treatments if they understood what could go wrong. Yeah.
I guess spinning this for some sort of learning point for injectors listening, how do you recommend that people do, I guess, signpost their qualifications for the general public? What should they be doing to say that I am qualified and I am safe? Like, what should they do?
In terms of where they signpost their credentials?
Yeah.
Well, obviously, website, social media.
What do they actually say?
well, I'm a registered medical practitioner or registered nurse with this many years experience. If there's any pertinent, background in terms of their training before they went into injectables. So obviously you did surgical work. Nurses may have experience in sort of high dependency situations, whether it be in intensive care, emergency,
theatre,
anything like, anesthetic work, anything where you've got skills that would relate in some way to what you're doing from a safety perspective or an anatomical knowledge perspective, for sure, absolutely.
I mean, I have seen some people literally put their ARPRA number, which, it's not a strange thing to do because some people might actually want to check that. And of course, we know there are many people, and it's becoming more common, where you actually go and search their name, and they do have conditions against their license. They potentially have to be supervised, or they're suspended, or something else. Yeah. So, if you were the general public, I would be looking at that.
Because that to me seems quite, a lot of those restrictions and penalties seem pretty lenient. Yeah. When you look at the severity of the situation, like giving someone like a temporary ban and having a $25,000 fine, that was like 15 years ago. So obviously $25,000 today isn't worth what it was then. But that seems pretty insignificant when you think about the outcome of that. It seems pretty light. I mean, the other thing that I've seen as well is that people will say, oh, I'm a doctor or a nurse with this many years experience. And the patient assumes that they've had injecting, but they're like, I've been injecting for 5 minutes, but I've been a doctor or a nurse for 15 years. And that's kind of misleading too. I've seen people use that strategy quite often.
Yeah.
Have you seen that as well?
Yes, I have. And,
because they're not technically lying, but they're just kind of sort of lying through omission. They're not really, it's a little bit cheeky, I think.
No, I agree. It was something funny. I'm going to get up an article, so we will cut out the pause as I'm looking for this. Okay, here we go. Talking about lenient sort of fines and things, and we were talking about our regulator a few podcasts ago, the TGA. So the TGA put on their own Instagram. They've got their own Instagram. We have issued 2 infringement notices totaling $7,512 to a Victoria-based nurse for allegedly importing unapproved prescription-only and cosmetic injectable products. These included botulinum toxin A vials and pre-filled syringes containing hyaluronic acid. The medicines and medical devices have been seized at the border and will not be released. So again, they're almost, I guess, signposting. Look what we did. We gave someone a $7,500 fine, but for me, that's pretty lenient for what they are trying to do and the risk we've just spoken about, counterfeit product and the risk of that. Just doesn't seem to add up. And yet the TGA are almost announcing how good their work was with that post.
I don't know.
What do you think of that?
Well, it doesn't seem like a figure that's scary enough to dissuade someone from doing it.
Well, probably made, assuming this isn't the first time they've imported, they probably made more money in a day than that.
Well, it just shows, I think, just the disconnect between the reality of our industry and the understanding that the regulators potentially have of it. It doesn't seem to correlate because, as you said, that doesn't sound like a punishment that fits the crime.
No, and no mention. Well, actually, we don't know if ARPRA have also been involved separately to talk about their license. Their registration. Yeah. But you'd hope that conversations happened.
Yeah.
And this is where regulation, for me, falls down. These regulators, they don't necessarily communicate. Yeah. And just because you've been caught importing the stuff doesn't mean that there's another more serious issue. Well, what else is going on in your clinic?
Yeah. Yeah, that could just be one thing.
And that's a patient safety issue, not just like an economic issue of saving some money by getting some cheaper product. It's a safety issue.
Yeah.
So crazy stuff. I guess last trend that we're certainly going to go into in more podcasts, and we've already done one with Dr. Izzy Silar, is this kind of new wave that is becoming much more vocal of regenerative aesthetics, I think we're calling it.
Yeah.
We've seen Dr. Tim Pierce being very vocal about it on his own channel, sort of almost saying, this is my path now. And you're seeing other injectors sort of being more vocal about bringing wellness into their clinic. But it seems to be, it's not even a trend now, it's a thing. Mm-hmm. So where do you think it's going? And I guess the bigger question is, well, what is it that clinics like myself or clinics that you mentor, what do they actually bring in?
Yeah.
What do we mean by it?
Well, I think this is always coming. As I said to you before we recorded, I mean, we were making these predictions on the podcast in the early days of recording our first episodes. We were talking about the inevitable sort of linking up of these two disciplines and thought processes. So I think if I look at it from just a theoretical perspective, when you're treating people with cosmetic injections, whether they be toxins, dermal fillers or biostims or what have you, you're treating a symptom of a problem. And the problem is, well, whether you want to call it a problem or not, but the issue is aging. You know, aging is the highest risk factor for every chronic disease, really. And so we're getting to the symptom end, whereas this thought process is getting to the causation.
Yeah.
And so it seems obvious that these two things were going to eventually align and become almost one in the same discipline. To get to your question around how do we do it, I think that the first step is just being aware that this is an evolving space. Yeah, we was talking in the last episode with Dr. Silla, we were talking about education, and one of the institutions that she's worked with and designed the syllabus for is the AACDS, which stands for the Australasian Academy of Cosmetic Dermal Sciences, and they offer some certificates and further training and education on these topics, so women's hormones, you know, introductions into regenerative health. And so I think that's kind of where people should start going, is seeking out where they can get preliminary education. We've got some episodes coming up on epigenetics and bringing things like biological aging tests into your clinic. So just like the Visia machine is the impetus for skin treatments and letting people know what's going on beneath the surface of their skin, these sorts of genetic aging kits and looking what people are susceptible for based on their genes and genetics. This seems to me, I think you'll start to see these things start to get integrated into people's practices. So we're in the preliminary stages. Dr. Izzy said she's not an expert in everything. Her thing is female hormones, so treating women with peri and postmenopause, and that she's got a team of people around her that sort of they sort of share patients with depending on their area of expertise. So she does hormones. She's got someone that she refers to that specialises in peptides, which is an interesting space as well. I think there's been 3 products now that are now TGA approved to be used. When you start looking at nutrition, sleep, you know, all these other things like biohacking. So I'm talking to some people at the moment that are opening up a clinic in Australia that are going to have like hyperbaric chambers in them. They're going to have infrared saunas. They've got cold plungers. They might be doing some, even though we're talking about IV stuff, they might be looking at bringing IV stuff in as well. So people are starting to look at things they can add into their clinic and bringing in regenerative doctors or people that have experience in this space and then starting to develop their network. So I think, you know, where do you start? I think it's starting on your own education, understanding what does the term actually mean, looking at for places to start doing some preliminary education. That to me seems sensible.
Yeah. And, you know, I'm not for or against IVs. If they're used appropriately, then that's good. But whatever you choose, you know, of course, there's a safety perspective, but there's also an efficacy argument. So whatever you choose, do your research, just like you're going to learn injectables or whatever modality you're using already. You need to go back to that core science. Yeah. Look at the studies, get training, get a diploma or whatever it may be, because you can't introduce something that it's like fairy dust or pseudoscience. It's got to have a backing, right?
Yeah. Yeah.
And I guess my only worry with regenerative aesthetics, because it's so young, is that we're almost just throwing stuff at the wall and seeing what sticks. Yeah. There's a danger that we do something that sounds cool and trendy, like infrared saunas, for example, which may be great. I don't know. I don't know the evidence, but what is the science? Yeah. And what patient is best for?
Yeah. Yeah,
so,
absolutely.
You know, treat it like any other specialty.
Yeah. So getting back to one of the certificates that you can do through the AACDS. So one of them is the Professional Certificate in Integrated Health and Dermatology. So it will enable students to learn about the gut microbiome and how it influences a multitude of skin conditions such as acne, rosacea, accelerated aging, as well as mood, weight gain, weight loss, and general overall health. Yeah. So that's probably good places to start. Listening to podcasts, we're going to attempt to have more discussions on this topic with various people from around the world who have sort of delved in and got a lot of experience. Yep. If you are interested in these courses with AACDS, we do have an offer that's going to be, you hit to click the link at the bottom of the podcast to go there, but it's simply IA10, which is the standard code, and you'll get 10% off.
Yeah, so just go to IA offers and then, follow the course link and then you can apply your code.
Yeah, absolutely.
Yeah, we try and make it easy for you guys. It's all there. Well, that wraps up this kind of new type of episode, mini-series on trends and aesthetics. I mean, I know there wasn't sort of high on detail, but certainly interesting.
Yeah, for sure. And if you guys see articles that we don't see here in Australia,
yes,
you think there's a topic that you'd like us to talk about or you'd like us to give a shout out to, please let us know.
Yeah, and we discussed this off air, but I didn't sort of make it explicit. I'm going to set up a WhatsApp group for anyone who wants to send us messages like that, because I think it's easier to contact us with random stuff. You don't have to be a patron. This is free just to sort of communicate with us rather than emails and trying to sort of find out our phone number. Just I'll put a designated WhatsApp link, and then you can just send any message you like from around the world.
Perfect.
Make it easier for you guys. Cool. Well, let us know what trends you want to focus on next time, or news or salacious gossip.
Yeah.
I didn't want it to be like a trashy one where we're sort of talking about celebrity, plastic surgery and stuff, but you never know. It may be relevant one day.
Absolutely. Oh, well, it's all part of what we do.
Yeah. All right. Well, I'll see you in the next podcast, buddy.
See you, mate. Bye.
Bye. For our latest news, follow us on Instagram at Inside Aesthetics Podcast. If you want to get in touch with myself or David, follow us on Instagram as well at Dr. Jake Sloane and David_Inside Aesthetics.
Join our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, live and interactive Zoom sessions, hints and tip videos, webinars, and more. Head over to www.insideaesthetics.com/Patreon for more information.